is just a huge honor for me today to be podcasting Dr. Dan Fischer, the founder and CEO of Ultradent. He started dental school in 71. He graduated in 74. He started planning Ultradent and doing research on it in 75 and finally got it open in 78. He is the founder and CEO of Ultradent, a dental manufacturer with a 30-year history of innovation and quality. Now an international leader in the dental industry, Ultradent began humbly in Dr. Fischer's basement with his children as its first employees. As a young dentist, Dr. Fischer realized that rapid, profound hemostasis was imperative for quality operative dentistry. Because there were no products on the market that predictably controlled bleeding and sulcular fluid, he developed one. Over 3 decades later, Dr. Fischer is still revolutionizing the dental industry. He has numerous patents to his name and regularly lectures and writes articles about the state of the art of dentistry. He also works part-time in his daughter's dental practice, which enables him to connect with patients and practice minimally invasive dentistry, a philosophy around which Ultradent develops products and procedures. Dr. Fischer strives continuously to improve oral health globally and hopes to one day discover a cure for caries. In pursuing these goals, Dr. Fischer is a generous philanthropist, regularly donating time, money, and products to countless personal missions and organizations such as Sealants for a Smile, which places sealants on the teeth of children with limited preventative dental care. Dr. Fischer also champions the Diversity Foundation, which provides educational opportunities to vulnerable and underprivileged children and has helped transform the lives of many young dentists who have been victims of FLDS polygamy. Driven by a strong moral code, Dr. Fischer lives his life accordingly to the same values that guide Ultradent: integrity, quality, hard work, innovation, and care. When he isn't working, he's enjoying tending to his garden, spending time with his family, children, and 30 grandchildren. Dan, thank you for coming on during these very challenging times as now North America, United States, is asking dental offices to close. And there's a lot of fear, there's a lot of panic. A lot of dentists have student loans, they have office mortgages, they have staff, they don't know how they're going to make payroll. Thank you for coming on the show. Will you please give us a coronavirus update of how you see this, since you have 1,600 employees spread out around the world and can see this entire industry at 30,000 feet?
Well, yes, Howard, and as you can imagine, the reports are different for different parts of the globe. We have our own offices for marketing and sales in 9 locations globally. We have our own warehouse and marketing and sales in both China and Japan. You can imagine that we first started feeling the impact of this coronavirus in China. We have about 35 employees there who have had to hunker down starting some time ago. The sales of our products and other companies' products virtually ground to a halt there for some time. We have, in a similar way, Japan has gone down substantially. You can envision with our offices for Southern Europe in Milan, Italy, all of our employees there were sent home to work from home, and shipments into Italy have been on hold. Amazingly, Germany is holding strong. The last I seen, there still was not a reported case of the coronavirus there. We could learn something from the Germans. Certainly, we're looking forward to things turning around. We're not at the turnaround point yet in USA. North America obviously is feeling initial impacts, which we've all seen grow daily, especially over the last week and a half. For USA, all 160 of our outside sales rep who call on dentists across all of America in most every state, they have been instructed to stay home and work from home on their computers, email, texting, and the like. all of our administrative, inside customer service people, marketing people, accounting people, and some others have been instructed to work from home. We have been scrambling to get laptop computers to those who do not have or did not have such available. We are driven to keep some amount of manufacturing going, so to service parts of the world who haven't shut down yet. We are taking great care, however. Our president, Dirk Jeffs, and myself visited about 10 different groups of our manufacturing teams who operate over 3 shifts, personally giving them directives of what to be careful with, how to sneeze into their elbow, how to keep social distancing. We really ought to change that to physical distancing, Howard. We want to stay close socially, but we just want separation physically. But at any rate, we also have OEM manufacturing that we do for other dental companies, and we manufacture some 65 million tubes of toothpaste for one of the 3 largest oral healthcare companies. That part of the operation will most probably continue to work and function in a good way, at least economically, as I'm sure people are going to continue to buy toothpaste. They're not going to stop brushing their teeth. But certainly when it comes to the subject of dentistry, as probably all dentists know by now, just a few days ago, our ADA requested that dental procedures be limited to just those that are essential. The White House came out today, I believe, with a similar message for dentistry. This has been a heck of a ride. It's a very dynamic, a very fluid situation, Howard. And that was part of our message to our employees. About 8-10 days ago, we sent an initial email to all employees giving them a heads up on what we planned on doing. We had developed strategies starting a couple weeks ago, and those strategies range 1 through 4. We are now at level 2 and partly into level 3. But as promised to all of our employees, we are communicating daily with them, sometimes more often than that, and with the overall explanation that we are going into uncharted waters as a human race. We are living, for the first time ever, a pandemic of this proportions that all peoples of the world now are fully aware of or close thereto. This is the first time that extensive travel of the proportions that we live now in the 21st century, the first time that this magnitude of travel has helped facilitate the moving of little incubators / humans all across the globe. And it behooves us that we pay attention to good logics, a good understanding of virology. I believe it is very important that we pay attention to those who have experienced this firsthand prior to our portion of the pandemic here in USA. We should be learning from what the Chinese have learned. We should be learning from what other scientists have learned. This is a global problem. We should keep our ear to the ground in a global way.
So there's so much fear going on, and a lot of fear is catching the disease, having a patient contract it in your office. Just now, the Ambulatory Surgery Center Association urged ASC to remain open for elective urgent surgeries and provide safe guidelines as a growing number of COVID-19 cases are reported in the United States. With 4,138 cases of the coronavirus in the United States and 71 deaths as of March 16th, the consensus. I mean, it's just all bad news. So, Dan, you started dental school in 71, and you got out
Yes.
in 74. There's a lot of
Yes.
kids who just got out, a year ago, 2 years ago, and they have student loans, they have a dental office, they have staff. What advice would you give them? They're going to have to cease operations. Patient flow equals cash flow. They won't be able to pay their bills. It's just pandemonium. What advice would you give the young dentist?
Well, I would give the young dentist the same advice that I would give to every company, to every individual, to all solo practices, group practices, DSOs, and the rest. And that is to remind ourselves that we are all in this together. I wish I had a magic wand that I could simply say, all coronaviruses die here and now. But we're not going to see that make-believe solution. We're not going to see a vaccine soon. But back to the economic questions for young dentists, and I would say for most, I would suggest that you keep your lines of communications open with those lenders who have helped you with money to start your practice. For sure, we all want to do all we can for our employees, our staff in the case of dentists. At Ultradent, and as I believe the case must be in all dental practices, those lovely humans who work for us and with us, we must make them our first priority. First priority to keep them safe. Yes, next priority to help them as much as we can with their needs of feeding their families. Now that can hit us in the gut when we've got our incomes closing down on us and rapidly. At Ultradent, we've made a decision to support our employees for X amount of time, and beyond what their paid time off will pay should that be needed. But we know that we can only go for a certain length of time, and then we put our businesses, the dentist businesses for the young dentists and others, we put our businesses in jeopardy. And our message to all of our employees that we did with all of the individual groups was that we want to do everything we can. You, our employees, are top priority. But please understand, we could get to a point to where if we kept paying you your salaries, your incomes, we could put the entire company at jeopardy. And then everybody would lose their jobs, be it young dentists, old dentists. My recommendation is they have a similar message. We cannot afford to be short-sighted, living just for the moment economically, and dispel from our brains where we're going to be when this blows over. So even, at least for us, even if that means losing some significant amount of our cash flow, our cash, and in some cases, and especially for young dentists, having to borrow if necessary, not being foolish and thinking you can be the sugar daddy for everybody under your supervision, but doing what you logically can, and even with the realization that how you treat your people now is going to have a lot to do with how they look at you when we come out of this mess. And we are going to come out of this mess. The message that I give, that we gave to all of our employees, is we will get through this. We will get out of this mess. And when we get past it, we will be stronger than we ever were before. Now, hopefully, our federal government sees some way to help supplement our employees for when money begins to run out or has run out. Our government is in a better position to be coming up with money than the individual corporations, solo practitioner dentists, and the like. But we can't hang our hat on that. We have to operate as though that is not going to happen, and then just become jubilant if and when it happens. So for you young dentists, tragically, the instructions are to see only patients who need essential procedures. In my mind, that means emergency treatment, but yes, that might vary based on other conditions as well. My suggestion, if in fact you don't have to go in special every day to see patients for emergency treatment, I would send out a message digitally to all of your patients telling them that you're going to be available for this one day out of the week or this one day every 2 weeks to address special needs that they may have, but to have them rest assured that if they call in pain, you will answer the phone, you will take care of them. Our patients, in the case of Ultradent, our dentist customers need to know we are there. They need to know we care. They need to know that we are determined to do everything we reasonably can, keeping them first safe and taken care of.
Keeping patients safe, it's all over the news today. A University of Florida College of Dentistry student who treated patients is among the first confirmed cases of COVID-19 in Gainesville. The student had traveled to Portugal over spring break, continued to work in the school's clinic despite not feeling well. He told his classmates in an email, and somebody emailed, one of his classmates emailed it to the Sun. And lots of people are saying that dentistry is the most dangerous job because of creating these aerosols. Do you think dentistry is, when we get through this, it's going to be really tough if you were the dental office that started spreading cases in your area, and it's just going to be horrible. But do you think dentistry is ground zero for the people who need to stop first, or what about emergency patients?
Yeah. I shared earlier, Howard, that I believe it is so important that we pay attention to what other countries have gone through who were ahead of us in the curve of this infection. It has actually frustrated me that our own CDC, our own ADA even, were as late as they were in getting information out that was available from other countries. Case in point, China. An article that I will send to you, Howard, along with 2 other articles I would think you may want to post on your Dental Town website. But in the International Journal of Science, some 4 Chinese researchers in Wuhan, China, which appears to be the epicenter of this virus, at least as far as human infection goes. They had a specific article targeted right to dentistry. And okay, they handled so many of the usual type of protections that one should do. But you already mentioned what is probably the single greatest concern, challenge unique to dentistry that is not unique in any of our other healthcare professions. This little fabulous device invented in the 60s that we call the high-speed handpiece. It is a little miniature jet engine. That turbine rotates at around 500,000 RPM. A standard electric motor, if you've ever watched the shaft rotate on it, it's only rotating somewhere around 1,700 RPM. So do the math in your head and you get an idea of how fast that thing's rotating. Now, clear back in the 70s, there were tests done in which red dye was put into the oral cavities of humans posing, being worked on like dental patients. And the high speed was run in their oral cavities. And they were able to follow those little droplets over onto the counters, up the walls, across the ceiling, down the other wall, down across the other counter, and down to the floor and across. Meaning that we create a microspray with these little mini jet engines. And yes, there's other ways that cross-contamination can occur, and we must follow the same guidelines as every other healthcare professional, complete with autoclaving our handpieces and the like. But it wasn't until just recently that any significant noise was made relative to this aerosol you pointed out, Howard, that comes from these little jet engines. So what do we do to keep our staff from being infected or ourselves from being infected? I just picture our lovely dental assistants sitting on a chair across from us, sitting a few inches higher than us, leaning over that curved bar so to be able to have the best visibility possible into the oral cavity of the patient. And very importantly, so to keep that high velocity vacuum as close to where the high speed is operating as is humanly possible. And even as that is one of the things we can do to minimize that aerosol spray. As taught in this article of January of this year from China, they point out what we all know to be the case, namely, if we'll work with the rubber dam, we can reduce that aerosol substantially. From the work they did, they stated that it reduces the aerosol 70%, quote unquote. I would like to think if we put that rubber dam on and kept it tightly fitting around the neck of the tooth, even caulking and sealing it, and I don't mean this as a commercial, Howard. We're never going to get rich selling Orasil caulking. But if they would take our unique Orasil caulking and express it down around the tooth that the clamp is going to go on to before inserting the clamp, it will assure a tighter seal so that saliva doesn't seep in and around the area you're working on top of the rubber dam. We know there are other challenging areas, like when putting a rubber dam clamp with rubber dam on a ponic of a fixed bridge. Now we've got a gateway for a lot of saliva to flood into the area that we're working. Get that caulking material, express a large gob of it in there. It'll swell a little due to the saliva, and it will seal that area off, even a substantial space around that ponic.
Is that under whitening, bond etch, composites, crown and bridge, endo, impressions?
It is good for all that, Howard.
No. Which category is it on your website? Is it under tissue management, Triadent?
Oh, that is not under tissue management. I think it might be under prepare, but all they have to do is go to the index on our catalog, which is on the web, and look up Orasil Caulking, Caulking. I developed that back in the late 80s. It's similar to the caulking we put in and around our window sills, door frames, and the like to keep the cold wind from blowing through in the winter. If they're filling in a substantial area, they should use the more viscous form of it called Orasil putty. That's kind of like a plumber's putty, and that can fill in substantial areas. It's quick and easy. It can be applied even in the presence of saliva, under saliva. It is hydrophilic, designed to gently, reversibly adhere to saliva wet surfaces of teeth, the underside of ponics, and the like. So those are things that I think can improve beyond the 70% level that came from this Chinese article. But dentists, if they are staying to essential procedures and perchance a near exposure, perchance that arguably is an essential procedure, perchance a large broken filling that is ulcerating the soft tissues, a large lesion in some tooth, that may be considered an essential procedure.
And the reason I wanted the details on it is because the coronavirus, right now it's an acute situation. People are closing down, but even eventually it's going to offices are going to open back up, whether that's 30, 60, 90 days, but that virus isn't ever going away. I mean, it'll be back in the fall. It's not going anywhere. So these are going to be long-term changes dentistry, kind of like HIV in 1979 really changed dentistry. You started dental school in 71. What doesn't kill us makes us stronger. How have you seen gradual adaptations since 1971? Because if you look at dentistry pre-HIV and how it's changed so much on this is just one more step up the stairway, isn't it?
You know, Howard, you're totally right, but I need a favor from you, Howard. I need you to give me 2 more minutes to share what is so important on preventing this cross-contamination. And those who are most prone to be infected are those whose faces, noses, and the like are the closest to the oral cavity when that high speed is running. Our staff, we've already talked about. The dentists, we've talked about. For sure, use the face mask, but with the knowledge that we all are aware of, that it has limited capability of preventing these small viruses from gaining access to our air passageways. Special fitting, special filtered masks are needed for that. But for those cases that a rubber dam can't be placed, this article teaches to use a 1% hydrogen peroxide, have the patient pump it through their mouth some 20 seconds. Another article that I'm going to post on the website that I think is so important is an article out of Germany. And this article was published this January in the Journal of Hospital Infection. And it's the results of 4 virologists, German scientists, who did their own work, their own testing. To cut to the quick of that article points out, as per their testing, that versus the 2 to 4 days that have been taught by our CDC and elsewhere, versus that 2 to 4 days that the coronavirus can potentially stay alive on an innate surface, this study points out that they can live for 9 days on that surface. That's important for all healthcare professionals to know, and even why this was published in the Journal of Hospital Infection. So what can be done in this regard? To cut to the bottom line of their study, they show that some of our more recent, even exotic antimicrobials, such as chlorhexidine and some others, are not near as effective as some of our oldest antimicrobials. And these older ones are readily available almost anywhere. One of the antimicrobials that is the best, that functions in very low concentrations to kill these little virus buggers, it is sodium hypochlorite, household bleach. And yes, in a 0.1% solution can disinfect counters. In a 0.5% can disinfect hands. The other one of older origins and very common is hydrogen peroxide. I think this information has finally gotten out through some sources, but they show that a 0.5% hydrogen peroxide can disinfect countertops and the like, and a 1% for skin sanitization. So there are things we can do. There are people who have been on top of this. We must be paying attention to our CDC and our ADA. But there are other sources that can give us further insights as well. Now, to come back to your question when I asked for the favor, Howard, if you would be able to remind me of that question in a short, concise way, I will answer it.
I'm just saying, since you came out of dental school, I mean, we've been gradually getting better. Like, you know, until the AIDS epidemic came out, we weren't wearing gloves and masks. I mean, and every time one of these endemics has come, we've made long-term permanent changes. And you've seen that. I mean, you started dental school in 71. Don't you think we're a lot better prepared 50 years later than when you started dental school in 1971, as opposed to the kid in Gainesville who tested positive for COVID-19?
You know, I think we are better off in many regards. For sure, on the hepatitis subject, we are. On the HIV, we are. Another benefit there, as you know, is the treatment options available for AIDS. But if we are really serious with ourselves, I don't think a lot of us use the rubber dam as much as we did in dental school. And I'm talking not only 1974 dental school use versus private practice, but I'm talking 2020 dental school use versus private practice. And mind you, there are just a lot of cases, especially with our aged populations with their wraparound root caries and the like, that rubber dam isn't always possible. And mind you, there are times that we just can't put a rubber dam on. We do have to learn how to minimize the risks when this isn't possible. But I also believe, Howard, that even though we knew, or hopefully knew, about the aerosol from this high speed and how far it can be thrown in its plume of micronized saliva, we've not been thinking about it enough. We've not been teaching it enough. We need to be reminded of it more. I do believe when we are past this coronavirus, I believe, as is the case a lot of times, we will be going back to doing things somewhat like we did before. When things are given to us as a mandate, so for example, OSHA saying we shall wear rubber gloves, and we shall wear eye protection, and we shall wear face masks, those kind of things carry through pretty good. We humans, and I'm just as human and just as at fault at this as anyone else, I have relaxed back when the water level got lower, just like everybody else. I think each time we go through this, we want to remind ourselves that we have to be more vigilant. Now, from a practical standpoint, if one sees what is required to protect the healthcare provider, the nurse, the doctor, whatever, if we were so foolish as to impose all of that requirement, plus the infection-proof, air-pressurized chambers for every patient that we see and work on in our dental practice, we will end up pricing our dentistry beyond the reach of most of our patients, and they will end up getting nothing. We should do what we can do. We do have to be more vigilant when we have an infectious virus or other organism which is of this magnitude. And okay, only a tiny percentage of those who are infected become to a dangerous level. But versus the common flu, and a lot of why this has gotten the attention of so many people, scientists, clinicians, and others around the globe, is because when someone becomes infected, especially if they are in that group 50 and older, there is a higher probability they die from this virus than for the common flu. Somewhere around 4%, I think, for USA and some other Western countries. So, yeah, we've got to use common sense. We've got to be careful now. We want to use rubber dam as much as we can going forward. We have to watch what are the emerging and then the exiting of infections. Fortunately, we live at such a time that knowledge can be shared instantly around the globe, and nobody is a better example of the possibilities there than yours truly, Howard Farran, with what you set up as the largest global website for dentists. We're going to need to be vigilant and continue to share what we can, what we've learned everywhere and anywhere.
Dan, I think one of the things that's scaring people is it seems to be a triple whammy. It's not just the coronavirus, it's not just a pandemic, but the stock market has gone from 29,000 to 19,000. It's lost 10,000 points, but the national debt as a portion of the economy, I mean, it's always averaged about 30% of the U.S. economy. After World War II, it was 120%. They paid it back down to about 30%. And then when we had the Y2K problem, the national debt was only about 65%. Then it corrected to 55%. But now it's clear back up to it's over 110%. Warren Buffett knew this was happening a year ago. I mean, he hasn't been buying anything for a long time. He's sitting on 136 billion cash because he knew it was a bubble. So are we having a bubble pop during a pandemic?
Well, I think you hit the nail on the head. I think there are two things aligning. One is the bubble, namely that stock market just kept going higher and higher and higher beyond what many analysts felt it ever should have. And so it was most probably artificially high. And then you have something like this pandemic hit on top of all of that. And yeah, that's like a vacuum that sucks the innards out of the economy. There is that saying that says, when one bank coughs, all banks catch the flu. That is a classic example of what can happen across all industries, but particularly in banking, which tends to lead whatever direction the market is going. If we just take into account what we know most about, namely the dental industry. In our Ultradent products, the number of orders coming in to Ultradent as of yesterday was 90% less than what it was a week ago. And I think I shared, Howard, with you as recently as 3 to 4 days ago, it was down 50%. When those sort of trend lines occur, that does impact businesses and in a contagious way. So yes, our sales, our income, our bottom line will be going down. That happens in so many industries. We buy our raw materials from a lot of other companies, and globally, a lot of companies can't even obtain the raw materials they need to make their products. And in even a challenging way to our national security, whereas so many chemicals, high-tech items and the like could be found in America, virtually everything we needed for manufacturing, and if not in America, from Germany. There are a lot of our raw materials that can only be found in China. For us to think we could just disconnect from China, they don't know what they're smoking. Example, epinephrine. How important do you think epinephrine is to the human race? EpiPens, epinephrine for emergencies, and we could go on and on. 80% of that is made in Wuhan, China. And my understanding is that all of the epinephrine hydrochloride is made in China. That's the water-soluble epinephrine, like what would be in our anesthetic carpules and the like. So we not only have our economy being affected relative to businesses reducing, turning down, and the contagious effect there, we have what I would call a national security problem. We have got to get ourselves more independent with critical materials available in our country once again. But yes, back to your direct question, Howard. The economy is filling it. We have to be big boys and girls, however, and remind ourselves that everyone who buys stock, they are taking a risk. They are making a bet that the economy is going to hold strong. They're making a bet that no pandemic would occur. And tough as it is, for those of us who made that bet, we're losing that bet right now. Now, my bet is that it's going to come back up. It is going to take a while for it to come back up. China is already starting to come back up. We are already starting to see our sales trending in the right direction in China. The same for Korea. But then we have to ask ourselves, did we jump on this in America with the same level of commitment, expertise, maximizing the benefits of technology, having the organizational capabilities to do what China and Korea did? Now, granted, we are one of the leaders in the world with our Centers for Disease Control, with our scientists and the like. But just something to think about. You know, in Wuhan, when that hit, and tragically, the Chinese government ignored their clinicians, a tragic story of the MD ophthalmologist who tried to sound the whistle of the problem, and the authorities there accused him of rabble-rousing. He became the one who tragically died recently. But once they finally bought into it, they were all over it. You probably recall them putting up a hospital, a 5,000-bed hospital. They built it, they equipped it in 10 days. What are the probabilities we can do that here should it be needed in USA? The Koreans, with their incredible technological capabilities, they put up early on some check stations. So when cars would drive through, they would quickly check for the virus. I think they were just doing temperatures, but they quickly got to where they could do the coronavirus test, which with some simple tests, even out of Switzerland, can give a report within 10 minutes of the finger prick and the blood drawn. But then at these stations, as the guys would go by, they had to put their cell phone, their smartphone, on a scanner pad, much like we do when we're going to board the plane before we go down the gangway, the skyway. And with those patients, they were suspicious of being infected, thought they could be infected, or had been around a person who was infected. With the scan of that cell phone, it fed into a computer. And with all of the multiple stations around Seoul and some other areas that gathered all that data, all that information, and it enabled the development of lines to point to the common denominator of where those humans came from before they were picked up at the stop. These are the kind of things that are doable. This is where we're at technologically. But what concerns me, Howard, is I don't believe we are there yet. And I am worried about how long we drug out the response, how long it took just even to get this announcement to dentists on what they needed to be changing on so to help contain this virus and stop the spread thereof. So on one side of the coin, we can say, you know, it's getting better in China, or it's getting better in Korea. And we even can logically, however, with some level of speculation, say we think it's going to get better as we go into warmer weather. And we even see that there's less infected humans south of the equator, where it has been warmer through this winter time. Hopefully all of that is just tied to weather, and hopefully it gets better as we get into our warmer weather in North America. But this little question mark that I have in the back of my mind that keeps me significantly concerned: are those countries who are coming out of it, is it because of the weather, or is it because they attack the problem more aggressively? Or maybe it is both to some varying levels. That was a long answer to a short question, wasn't it, Howard?
It was. It seems you have a facility in China, and you choked up about Li Wenliang, 34, the Chinese doctor who raised the alarm about that. Why did that choke you up? Is it a deeper relationship because of your facilities in China?
You know, Howard, I'm kind of a big boob. And whether we had any of our people in China selling any of our products in China or not, I would still choke up. Why? I can just envision this young professional coming across this problem, discovering it as the first one, and trying to get the attention of his government to even help save the lives, not only of his family, but of his fellow Chinese and fellow humans globally. There are things that some dictatorships can do better than we democracies. There are some things they are much worse at. One of the things that I don't give China high marks on is listening to the individual and putting an importance on them, and even supporting that they must have free speech. And even if you don't like what they're saying, and even if you think it's going to cause problems and be rabble-rousing, as a democracy, we support that free speech. In that case, for that lovely professional, the government would have hopefully listened much sooner, He could even be alive today, and other co-professionals in China and their population at large. Now, the things they can, as a dictatorship, do better than us. We, in our democracy, and I totally understand why, we have to study, discuss, meet, go back and forth, back and forth, back and forth, even ideally working to get a consensus of a lot of people, experts and the like. Perchance we don't get the full consensus, but we have to work to get enough on board, and then to get the executive branch on board, the leadership on board, until finally something can be implemented. A dictatorship can get things done fast. You might have heard the name Peter Schutz. Peter Schutz was the CEO of Porsche, the German automaker. And Peter Schutz goes around the globe, and in his 70s, might be early 80s now, talking firsthand, with firsthand experience that he learned at Caterpillar tractor in America, then Cummins diesel in America, then asked to come and run Porsche. He said, for our businesses of Western worlds, of free enterprise, you have to come up with solutions, policies, and the like. It's important to have everybody weigh in so they have even ownership in the decision making. You do that like a democracy. But once that is agreed upon, you must execute like a dictatorship. There are times we need both. And even for capitalism to operate correctly, for business to operate correctly. And I believe we need to self-reflect, self-study, learn from this. And at our highest levels in government, our mid-levels in government, our lowest levels in government, what can we learn from this once we are past it, so that we are better prepared to act sooner on such a situation or a similar situation?
Dan, I'm going to get more of your personal feedback. You have facilities in 9 countries. What are they? China, Japan, Italy, Brazil? Which countries do you have facilities in?
We have them in Malaysia. We have them in France. We have them in Cologne, Germany, Australia. How many have we got there now?
Let's see. 1, 2, 3, 4, 5, 6, 7, 8. Let's see. You're missing one.
USA. How about that? We have to remind ourselves that when we talk about being a global company, that yes, even USA is part of the globe.
So, have you? What is the difference in the dental pandemic for China, Japan, Italy, Brazil, Malaysia, France, Germany, Australia, U.S.? You're having real-time, real-world feedback. What does looking at 9 countries make you think is going to give you insight to North America, United States, Utah, Arizona?
Well, I started by sharing what I believe is the most important area to look at, namely a country where this started from, a country with substantial, statistically significant size even for the data collection and for the study of said data. That I would put as the most important one that we look at, listen to, and that I believe we should have been listening to better, at least by our January. Now, we've talked about Korea. We don't have an office there. Italy, they have been fairly hard hit. There could be some things we could learn from Italy. We have a general manager there who is an MD. He is very aggressive on keeping his guys and us abreast of what's going on there. Germany is probably the best example of where things are working the best. Some of the Scandinavian countries as well. I don't know if I've totally answered your question or not.
Well, let's go to Germany. I mean, they make amazing cars. I mean, what do you think succinctly that we've learned from Germany that we could be doing today in the United States?
Well, this one article that came out in January via German virologists and shared through the Journal of Hospital Infection, to how I understand it, they took that seriously. I believe they took the physical distancing more seriously. I do not know for sure how much dentistry has trended down there. Why? Because through all of these affiliate countries, except Brazil, where we manufacture, through all these affiliate countries, we sell through dealers. So we do not have the direct contact to our dentists like we do in USA. So whatever we see via the dental sales path that goes on in these countries, there always is a lag time, because there will be our products sitting on the shelves of dealers. And as the dental trends down, we won't know about it until we see the international orders trending down again, but that comes with a lag time.
So, I love, when I think about Dr. Li Wenliang sounding the alarm in China, it always reminds me of the Janis Joplin, freedom's just another word for nothing left to lose. I've always loved it in history when when fear was not an option. Living in fear is not an option. We're all going to be dead someday anyway. 92% of all the humans that ever lived, 108 billion of them are already gone. But it is just very inspiring when someone does the right thing, even when it costs them their life. But it's funny. I've always argued with dentists that tell me they're patient-centered. I say, no, you're dentist-centered. I mean, your hours are Monday through Thursday, 8 to 5. How could you tell me you're patient-centered? But I think the truest sign of being patient-centered is not having your patients contract COVID-19 from you.
Yes, that is totally right. And not only not from you or your staff, not indirectly from other patients, but very importantly, that we do all we reasonably can to keep patients, even patients who unknowingly are carrying the coronavirus, from infecting back to us, our staff, and our other patients. And something else that has been learned more recently is that it appears that humans can be infective for a few days before the infection symptoms are manifest. We have to do all we can. We can't know all who are not showing the symptoms of coronavirus, but it just underscores the fact that we need to do all we can do. On a realistic note, and to help remind us that we shouldn't freak out more than necessary, this is not as threatening as the plague was in Europe in the Middle Ages, at least for the people in Europe. But what does make this of greater pandemic commotion is that with modern transportation, it travels globally in days or even hours. Yes, once people are infected versus the common flu, there is a higher percentage that die than those infected with the flu. But even without a vaccine, even addressing with palliative treatment the symptoms, keeping people breathing as they need to, and with oxygen and the like, we can reduce the death percentage dramatically. And even one of the benefits of being in a modern society with modern medicine. Thank God for modern medicine. So there are upsides that we should remind ourselves of, and how fortunate that we are to live when we are living and where we are living. We always can do better.
You know,
we should additionally, Howard, and this is a little tricky to say. I wish I could say it in words that I had thought out for some time before I said it. But reading this morning on Google News, CNN News actually, as of this morning, we have had 112 fellow Americans die of this virus. Of those, all were above the age of 50. So we've not had kids dying. We've not had 30-year-olds, 40-year-olds. This reminds us that, yes, for older people, we need to put more attention there. Yes, everybody needs to be cognizant and careful because young people can infect older people. But I think the more we realize about these practical realities, statistics and the like, the better we can be in our decision making, even finding our comfort zones where we can. And something that we've found important in our company and even in our upper management teams, it's so important that we don't begin to take ourselves so damn serious that we cease to be human. We need to look for the chance to laugh now and then. That's healthy for us. Even gets the endorphins moving. For you young dentists with your damn high debt and staring down this gun barrel, you make the commitment that you will get through it. You keep communicating not only with your patients and your staff, exercising care, but you establish good communications with your lenders. I've found over the years that a lender is much more likely to bend when it's needed if you have a trusting human relationship with them versus if you don't. And if it's possible, look for the ways to sit down with them in a calm, relaxed setting and have a face-to-face meeting. Our digital communications are wonderful, but especially in tough times, it is invaluable to have the face-to-face caring discussions, even asking how each other's families are doing. How's the wife doing? How's the new little one doing? How's your staff doing? What are their feelings? How is your bank doing? How are things looking? Share those human caring concerns. And ideally, that is something that you've even done from time to time before a crisis comes. That is preventive medicine, even for business, if you will. It's preventive medicine for life. We are all in this together, Howard.
And on that note, thank you so much. I cannot believe that with 1,600 employees in the middle of a pandemic, you took the time to come on and talk to my townies on Dental Town. Thank you, Dan, for all that you've done for dentistry and continue to do. And we need leaders like you to stand up and lead in times of crisis, and I know that's what you're doing. Thank you for being around and being the leader that you are and always have been. I can't thank you on behalf of dentistry, but I can thank you on behalf of Dental Town. Thank you so much for all that you've always done for dentistry.
Thank you, Howard. And just one last note where I have this special opportunity to speak to more of my dental colleagues and customers than under any other venue. Thank you for all you do. Hang in there. We're going to make it through this. You hang in there. We'll hang in there with you, and we will get past this.
You know, when I grew up in church, they taught you to treat other people like you wanted to be treated. And the first time I met you, you taught me the daughter test.
Yep.
Tell them what the daughter test is, and how does that relate to religion? Treat other people like you want to be treated. To the daughter test. What does the daughter test mean to you?
Well, you already mentioned, Howard, patient-centered. We need to be patient-centered, and one of the more important ways that we manifest that is if we are tooth-centered. So I share each and every time before we touch that high speed to that enamel, to that dentin, remind yourself, this patient, they are my daughter, they are my son, they are my parent, they are my spouse. They are all one and the same as our patients. Every treatment, we should remind ourselves to pass the daughter test.
Well, how's your daughter, Jelena Jessen, doing?
Oh, my daughter, Jelena, is doing just great. She has shut her office down for the week, except for the emergency patients that she must care for. And on one additional note tied to emergency patients, I would add that not only should we be seeing these patients, but taking all the appropriate precautions as part of the overall healthcare community. It behooves us to stand up and be responsible for these are patients who are in pain. If their only other option is to go to the emergency room, now that puts an additional load on our fellow healthcare providers who are already overloaded. loaded. That is one of the most important ways we can contribute, sharing those responsibilities. And with our colleagues in medicine, nursing, healthcare providers, first responders, and the like.
And dentistry needs first responders to get people out of severe pain and do extractions, because 2019, 8.5% of emergency room visits were odontogenic in order, and they don't need to be dealing with toothaches. Not only, in fact, they can't even extract the tooth. So all they do is give them Pen VK and Vicodin. So you're a first responder, and thank you for always being a first responder, Dan. You've been an idol and mentor to so many for so long. Thank you for all you do, and good luck with you through the pandemic.
Well, thank you, Howard. The same for you and yours. Take care, and a virtual hug to you and everyone else on your lovely program.
Oh, thank you, Dan. Have a great day.
Thank you kindly. Take care.
Bye-bye.
Bye-bye.